डॉक्टर हो जो स्टेम सेल स्पेशलिस्ट हैं हमारे साथ आज स्टूडियो में मौजूद हैं। इनसे हम थोड़ी सी इन्फॉर्मेशन हासिल करेंगे कि भाई स्टेम सेल क्या है, स्टेम सेल जेनरेटिव थेरेपी क्या है, और क्योंकि ये एक अथॉरिटी हैं और बड़ी बड़ी टॉप यूनिवर्सिटीज़ में भी इन्होंने अपने लेक्चर्स दिए और जो लोग जो हैं वो भी ख़ास तौर पर जानना चाहेंगे कि क्या है स्टेम सेल थेरेपी। तो आइए इनसे मुलाकात करते हैं। हेलो डॉक्टर हो, हाउ आर यू डूइंग?
Very well, thank you.
First of all, welcome to the program, and I would like to start off that what can you tell us about stem cell therapy and what is a stem cell regenerative therapy?
Well, that is not an easy question to answer, but I try my best. Well, the stem cell therapy or regenerative cell therapy is something that basically is a cell, is an element, the basic element in your system that try to keep you healthy and keep you alive.
Okay.
Since baby, that works for you without you knowing it. So stem cell, basically, the term of that is to a cell that is capable to continue to grow, continue to proliferate, and to repair and to reconstruct the damaged cells. That is called a stem cell, the basic live regenerative cells.
And every human body, like you mentioned, as an infant, when you are born, and every human being has those cells, and then you use those cells as to heal the body in terms of, for example, if patients have arthritis pain, a lot of people go through those pains for years and decades. So how does that work?
Well, okay, let's try to make it simple. For example, like the first cell, that means the embryo and the embryo, and then the cell is one single cell.
Okay.
But one single cell, because they're capable of grow into different type of cells, like heart cells, and then the lung cells and skin, so on and so forth. So that means you become a being out of the cells.
Okay.
So they retain the capability after a person is born. So the cell itself work for you. When the cell dies, and the stem cell basically take over, become a new cell. Mm-hmm. So that keep you almost like as if nothing happened. So that is the work of stem cells. Yes, the arthritis is a form of degenerative wear and tear process. The cell itself, then certain point when they have a body damages like arthritis, and they demand some kind of repair, the cells, the basic cell we call stem cell, which is harboring and stay in the body, and that's the time they being called for to help your body to repair. So that's a job of a stem cell.
So इसको हम इस तरीके से समझ सकते हैं कि जैसे कि ये खुदा की तरफ से या नेचुरल जो हमारी अपनी बॉडी के अंदर प्रोसेस होता है उसको ये रीजेनरेट जो है वो कर रहे हैं. So I'm just trying to help the audience also translate and help them understand in as a layman term. तो मैं इनसे और मालूम करूंगा कि ख़ास तौर पर हमारे लोग जो हैं जो आर्थराइटिस के पेन में होते हैं, और बहुत से लोग जो हैं बड़ी महंगी महंगी सर्जरी से गुजरते हैं, तो वो किस तरीके से स्टेम सेल रीजेनरेटिव जो थेरेपी है वो काम करेगी, ये मैं इनसे मालूम करना चाहूँगा. सो डॉक्टर हो, लॉट ऑफ especially elderly women, and even mostly I think arthritis pain is in elderly women, or what I hear from people, but also in men as well. So they go through this arthritis pain, and they go through these surgeries. Even a friend of mine, his mother few years back went through this surgery for arthritis. And what would you tell those type of patients that how can they get help, or they can seek treatment through you, through 7 Days Doctor Clinic? And since you're board certified, you're a stem cell specialist, what will you tell those patients who are still in pain and arthritis pain?
Yes. Right now, before the advent discovery of the stem cell, which is alternative therapy, that is almost like we don't have other option, like if something gets real wrong and the joint is not functioning, and the only remedy is to have surgery. But now, since the discovery of this regenerative cell therapy, then we know there's other form of therapy which can be extra and additional help. Because I hate to say the previous surgery is a kind of branch of medicine, just a progression of medicine, that there's something coming out new. That's called the stem cell or regenerative cell therapy. The treatment for that is rather simple because we in science we know the stem cell help to repair, correct? But we don't know when they in a massive number, for example, in terms of millions of the same stem cell, they act differently.
Wow.
They become a magic bullet. It's almost like unbelievably strong and very powerful. Even the things that seemingly that's hopeless, like a terrible arthritis, which is to the point you cannot walk, cannot do anything, you need to have a knee replacement. But in spite of that, it still can show tremendous improvement in terms of pain control, in terms of mobility, in terms of the longevity of the joint itself. It's obviously showing a lot of scientists' studies and experience showing that right now.
Okay, that's very interesting. So you're saying that instead of that knee replacement, यानी घुटने की जो replacement होती है या उसकी जो surgery होती है, उसको ये इस तरीके से बता रहे हैं जो मैंने देखा भी इनके वहाँ के they basically use the stem cell और वो inject कर देते हैं. So basically you inject the stem cell into that area, and instead of going through the surgery, that would be how this type of arthritis pain, and instead of going through the knee replacement surgery, it gets treated.
Mr. Zeeshan, allow me to give a little bit, slightly introduce the stem cell. Right now, in the layman term, the stem cell is pretty vague, and we might not be very understandable in terms that what is mean by stem cell.
Yeah.
There's so many stem cells. They're coming from the fats, from the bones, from placenta, so on and so forth. But basically, it can do one thing. The stem cell is a magical cell that can do the repair and then to reconstruct and to reduce the pain, reduce inflammation, reduce the cell death, so on and so forth. It's quite interesting and quite powerful in that sense. So the stem cell you're talking about is refer to the fat stem cell, adipose stem cells. There's one branch of stem cell, bone also, but we use as fat adipose stem cells, extract the stem cell from the fat. Okay, they've been staying there for the longest time since birth. You have that. So the doctor discovered we extrapolate all those cells and then concentrate them, and then they become a therapeutic agent and use that to administer to the point of need. For example, arthritis, the knee bone, knee joints, shoulder joints, back, so on and so forth. So when you inject inside, it starts to act up, become like repairman, basically, okay, to repair to the damages, to repair the scars, to reduce inflammation. So by doing so, your pain of the joints become diminished, and then your joint becomes stronger. There's some evidence, scientific evidence. The meniscus, they show some kind of regrow pattern, but of course it's all under research right now. That is what the stem cell would do for arthritis.
That's wonderfully explained. So does that mean anyone can go to 7 Days Doctor Clinic? I know first consultation is free, and people can even call 281-277-0220, and they can just call you, and the first consultation free, and you basically go through the patient. And how does that process work?
Yes, you just call the office and say, I'm interested in the other means of some kind of arthritis treatment other than surgery, and that I can offer them this option. It's not compulsory. I try to introduce this one to them the best I can to explain what it's all about. So that would be free. Free is not the point. It's more like educational. I want them to learn, to know something other than surgery, so alternative. The good thing about this treatment is that worst come to worst, that's not getting the worst what you already think quite bad. See, there's no scarring and there's no cut, and recovery time, downtime is relatively short. So there's all those good points about it. So there's no harm and nothing that unreasonable for you to come and seek some knowledge, basic knowledge about it. You can say no if you feel like it's not, but who knows?
And no one has to go through even anesthesia, because obviously when you go through the surgery, most of the surgeries you go through anesthesia, so वो आपको बेहोश करते हैं और फिर बेहोश करने के बाद जारी बात है वो जो anesthesiologist होता है उसका काम ही होता है और बड़ा अहम रोल होता है उसका भी, तो यहाँ पर वो भी ऐसा सिलसिला नहीं है. So Dr. Ho, there's no anesthesia or anesthesiologist involved with this type of stem cell therapy or stem cell regenerative therapy that you help with your patients.
Correct. So the advantage of this regenerative or stem cell therapy is mainly, one is relative simple, much simpler than a standard surgical approach. For example, like number one, anesthesia. Anesthesia is kind of can cause some complication in certain very serious complications. Two, the stem cell, no obvious surgery means you incise, creating a cut on the person. By doing so, the approach is less damages, because basically you introduce the stem cell into the joints by a needle. So a needle, just like a lot of patients actually in the past, they receive therapy like steroid injection. So almost like just steroid injections. But of course, steroid injection is very different from stem cell therapy. So it's rather simple, and then the recovery time is tremendous short. For example, like a patient asks me, can I go to work in a day or two? I say, well, you can actually go back to pretty much the way you do things in the past, for example, like 2 days later. But the only thing I advise them to, not use it, because the stem cell actually is repairing you. Just like you're repairing the construction people doing that, you just leave them alone. So for them to get the maximum time environment, if you go to sport, extreme job, that can interfere with the repairing process of the stem cells.
So you can go and return to work or return to your daily duties right away in 2 to 3 days?
Yes, almost like you can walk. Actually, now I did quite a few of stem cell therapy right now. The last 2 months we did 4 cases.
Sure.
Now there's one thing I observed very strangely that I can't explain, because in the past, we just try to assume that there's a lot of pain afterwards and so forth. But now we observe right after the therapy, the pain actually decreased.
Wow.
Just right on the top. For example, like I have 3 patients coming limping, and they walk out the office, they're not limping. I say, what happened? They say, wow, I feel like it's already working. I don't even believe that myself. I say, that's too quick, too true to be true, too good a case. But it shows that the result is really encouraging.
I remember one video that you showed me where this lady was sitting and she came limping. It was very difficult to even walk. And then after you literally inject as if she was getting a flu shot, and the way I'm explaining it, कि वो खातून को इन्होंने इंजेक्शन दिया जैसे फ्लू शॉट दे रहे हैं, और देन शी सेड कि भाई उनके चेहरे से नज़र आया और ये कह भी रहे हैं कि भाई देख के उठो, एंड देन शी स्टार्टेड गेटिंग अप, एंड हमने देखा उनको कि वो खुद वॉक कर रही हैं. दैट्स द वीडियो दैट आई एम एक्सप्लेनिंग, दैट you could see the facial expression on her face, that she was so happy and looked so content that right away, I would say, how long? Maybe 15-20 minutes?
Yes. In the real sense, it is behaved that way, the stem cells. Because you look at the stem cell, what they do, they're extremely powerful in terms of anti-inflammatory, repairing, reconstruction, the growth factors, and so forth. But the inflammation, the pain caused by the arthritis is few things. One, mainly is inflammation. Because inflammation, you produce a lot of those toxic elements and painful elements, okay? So that stimulate and then cause inflammation and touch the nerve and gets nerve pain, so on and so forth. But the stem cell seems like calm it down almost instantaneously. Right away, they start working. Cool it down, just like a fire. You put something on the top, carbon dioxide stuff, and dry ice, and it's cool down effect. Extremely true. I witnessed quite a few cases right now. Our colleagues and us, we have the same observation, and we plan to even write some articles, paper on that kind of effect.
That's excellent in terms of what I'm hearing, that how people who have been in chronic pain for years and they seek treatment. Now, let me ask you, obviously with arthritis and those different types of pains, even shoulder pains you mentioned, and obviously patients can go and get free consultation. The first one is free and it's an educational कि आप उनको call करें या फिर 7320 जो हाईवे 90 है वहाँ पर 7 days डॉक्टर क्लिनिक जो है इनकी फैसिलिटी मौजूद है, और यहाँ पे कॉल कर लें 2812770220 और फर्स्ट अपॉइंटमेंट ले लें, बिल्कुल फ्री है. अब सवाल मैं इनसे ये करना चाहूँगा कि क्या ये बेसिकली आर्थराइटिस टाइप या शोल्डर पेन या और दूसरे पेन्स जो बॉडी में होते हैं इंसान के जिस्म में, क्या अब लोग अपने आप को अच्छा दिखाने के लिए, अच्छा लगने के लिए, जैसे लोग बोटॉक्स का इस्तेमाल करते हैं या फिर लोग और दूसरी फेशियल के लिए चाहते हैं कि भाई झुर्रियाँ जो हैं चेहरे की, और ख़वातीन तो ख़ास तौर पर जो हैं वो इसमें काफ़ी आगे हैं, वैसे मर्द हज़रात जो हैं उनको भी अपने आप को अच्छा रखना चाहिए. तो ये भी इनसे मालूम करेंगे कि स्टेम सेल जो है वो भी इस चीज़ में काम आ सकता है. सो डॉक्टर हो, what about the facial therapy, or just to look good,
Yes.
if people go through these Botox treatments and they get Botox, what would you have to say about that? Can stem cell make them look beautiful as well, or better? All those wrinkles, some are gone, and people want to look 10, 20 or 30 years younger. Is that possible?
Yes. I don't want to put down my colleagues because I'm also aesthetic board certified aesthetic physician too. Everything there's a place, there's a reason why they're there. Okay, a Botox, fillers, so on and so forth. But the difference between the two is one is natural, the other one is not natural. The natural means it goes with the person. For example, it enhances the beauty and it become part of you.
Sure.
So that's the difference. If I go something else, I don't want to even mention names. For example, artificial means chemical, and to try to make you look good. That's tend to a little bit temporary. The other thing I observe, I was once upon a time a doctor to administer Botox, so on and so forth. But I have nothing personal against it. I just want something better. So that nothing is become natural. You see, most of the patients we have, when they finish the treatment, they went back home, and then the relative friends say, "What have you done to yourself? I mean, how can you look so different? Tell me, what kind of cream you use?"
Sure.
And they can't figure it out. It's so natural, you can't even tell the differences.
Excellent. So that's very well said. So Dr. Ho को आप कांटेक्ट कीजिए, और इनके ऑफिसेस को भी आप कांटेक्ट कर सकते हैं. 7 days Doctor Clinic. Dr. Ho is a board certified stem cell specialist. How long have you been practicing, Dr. Ho?
Okay, the stem cell is relatively new. Until now at this point, the worldwide, they're still under research entity.
Sure.
But because of research, we enter into treatment, do so on and so forth. That's been quite a while. Actually, some countries, they have more than 15 years, almost 2 decades.
Right.
But why is not being, let's say, a mainstream? Because it's something we just don't understand how it works. It can work so much that people almost like, oh, come on, that's not true. So we need more evidence.
I see.
In terms of this stem cell in the cosmetic reason, I think this is my 5th year.
5th year.
Yeah, 5th year.
So it's been 5 years now.
5 years, yes.
Perfect.
I've been practicing under the very careful research that has been need to be approved by FDA, because we want to do everything right, especially such a good alternative therapy. We value it much more than any other form of treatment.
एक्सेलेंट. सो डॉक्टर हो की क्लिनिक 7 days डॉक्टर क्लिनिक है, आप इनको रुजू कीजिए, और फर्स्ट कंसल्टेशन जो है बिल्कुल फ्री है, ताकि आपको भी एजुकेशन मिले, आपके जहन में कोई भी सवालात हैं. ज़रूर जब भी लोग किसी भी मर्ज़ में मुब्तला होते हैं तो हम हमेशा कोशिश ये करते हैं कि 2-3 डॉक्टर्स का ओपिनियन लिया जाए. तो यहाँ पर आपको ना से वो एजुकेट करेंगे, आप उनसे मालूम कीजिए और देखिए किस तरीके से आपके लिए स्टेम सेल थेरेपी और स्टेम सेल रीजेनरेटिव थेरेपी जो है वो आपके लिए किस तरह आसानी से बग़ैर एनेस्थीसिया और बग़ैर जो सर्जरीज़ होती हैं उससे बचते हुए आप निकल सकते हैं. और डॉक्टर हो जो हैं, इनका नंबर 2812770220 7320 हाईवे 90 पर ये लोकेटेड हैं. डॉक्टर हो स्टेम सेल स्पेशलिस्ट हैं, बोर्ड सर्टिफाइड हैं. सो आई एम प्रीटी कॉन्फिडेंट डॉक्टर हो दैट पीपल विल टेक एडवांटेज ऑफ यू, बिकॉज लास्ट टाइम व्हेन आई विजिटेड योर clinic, you showed me all these certifications, and you are the authority in this subject, and which is really amazing. And you have gone to all these different universities, which in the next time, in the next session, we will definitely go into those details as well. But again, anything else you want to communicate to our audience and to our viewers?
Yes, I would like to bring one point. When you come to the clinic, not just I want to promote the stem cell regenerative cell therapy, which is, of course, is very latest and cutting edge branch. But the other thing is when you come to the clinic, one thing is that I want to ask, everybody want to look pretty, but they don't know how the person should look. A lot of times they ask me, do you think I should, this area is not that good, that area is not that good. So I educate them, say, look, you look at yourself, pretty or not, is very different from I look at you, you're pretty or not. Because a lot of people, not just patients, walking on the street, I say, I wish that they don't want to put so much makeup on the area. Because they think they look good. But I say, that is the one that make you not very good. You take it off. So that's concept, how you assess, how you should look. Then, for example, like when the lady coming in, she looks real nice. And somehow she covered the area that looked the best. Like the other day, she covered her forehead, everything else. I say, why you cover your forehead? Oh, my forehead looks so ugly. I said, really? That's how you look at it? Oh, it's too wild, too big, and so on and so forth. Because, and then I say, allow me to adjust your hair a little bit. So I move her hair a little bit, expose a little bit. Then I let her look at it. I say, see the difference? No. I say, it doesn't look bad. I say, you look much pretty. Because actually the selling point is your forehead. So things like that, they have no idea. They cover the things. Because generally speaking, the forehead is not bad. The eyes, of course, some wrinkling and so on and so forth. I say the reason why you not look as good, allow me to say that, is you cover the part which is, she has no wrinkle, no forehead, or nothing wrong at all. So expose that. Then the people look at that, not just looking at the eyes and wrinkles. So look at that, more or less dilute the focus.
Excellent, perfect. So डॉक्टर हो से आप रुजू करें और देखिए किस तरीके से ये आपको गाइड करेंगे, एजुकेट करेंगे, और ज़रूर इनको जो है आप खदमत का मौका दीजिए, क्योंकि ये खुद बोर्ड सर्टिफाइड हैं, स्टेम सेल स्पेशलिस्ट हैं. डॉक्टर हो, it's a pleasure that you came to our studio and talked to us about stem cell therapy and what you do, and thank you so much for your time.
Thank you too. Thank you for inviting me.
You're very welcome. और ख़वातीन हज़रात, नेक्स्ट फ्राइडे फिर आपसे मुलाकात होगी लाइव ज़ीशान में. आप लोगों का प्रोग्राम को देखने का, पसंद करने का बहुत शुक्रिया. थैंक्स फॉर वाचिंग. अपनी दुआ में मुझे और मेरी फैमिली को शामिल रखिए, और नेक्स्ट फ्राइडे इंशाल्लाह आपसे मुलाकात होगी. अल्लाह हाफ़िज़, खुदा हाफ़िज़.